Hi, thanks for joining us for the first ever episode of the Mental Health Series. I'm Richard Valle, Alameda County Supervisor for District 2. This year has been a wild one for all of us, with the pandemic, elections, wildfires, and social justice movements happening throughout the year. I know we all have a lot on our minds. For this reason, we decided to make this three-part series to share information and resources that will help us all take care of our minds and mental health. While this series will be helpful for everyone, we wanted to focus on our youth, who may be isolated from their peers during shelter in place. In this episode of the Mental Health Series, we want to address the one thing that has affected the lives of everyone in the world in 2020, COVID-19. You will hear from Amaya, a very special young lady. She's a youth who lives in Hayward. She wrote a poem about how she was personally affected by the pandemic. We'll also hear from Dr. Nicholas Moss, Alameda County's health officer, who will lay out all of the facts and protocols about COVID-19. And Dr. Karyn Tribble, Director of Alameda County's Behavioral Health Department, who will give you tips on taking care of your mental health during shelter in place. Stay tuned for our special musical guest at the very end of the episode. Thank you.
Hello, my name is Amaya. I live in Hayward. I wrote a poem about coronavirus and what we faced and how I overcame coronavirus and school and graduated. Hey Mama, I have the chills. You're probably very ill. I'll make some soup so you can take a pill. I thought, I can't get ill. I'm the only one to pay the bills. I never thought that the chills will turn into a virus that can actually kill. Hearing the words, "You're positive for coronavirus," left me in silence. I felt speechless and lost. I questioned, God, why us? Don't let us die. Seeing my mama on a ventilator made me cry. This virus took my freedom for a short period of time. But for the long run, I graduated banquets high with pride. But now we won. We are coronavirus free. We are back as a family should be, and with my diploma degree.
Hi, I'm Dr. Nick Moss, Alameda County Health Officer, and I want to share a few facts about COVID and young people. I'm also going to correct a few myths. Just so you know, my medical training is in infectious diseases. I've worked in this field for over 12 years, so I know a lot about diseases we catch from each other. I'm going to talk about COVID and parties, masks, distancing, entertainment, indoors, outdoors, airborne transmission, dating, school, vaccines, and protecting older friends and relatives. We're still learning about COVID-19, but I think we can give you some solid information today to help you make healthy decisions to keep you and the people in your life safe. So let's tackle a myth first. Is COVID even real? You better believe it. Me and all the hundreds of thousands of people working on it, nurses and doctors, scientists, can't all be wrong, right? We've learned from years of scientific and medical advancements, including past pandemics and health threats, so we know a pandemic virus when we see one. But don't just take it from us. Take it from the more than 40 million people around the world who've already had COVID. Okay, let's bring it back to everyday life. What about parties? Fun, right? And we miss our friends. So what if you throw a mini party and there are not that many people there and everyone feels healthy? Is this okay? No, sorry, but it's for your own good and the health and safety of your friends and family. Groups of people together, especially indoors, is very risky, and people can spread COVID even when they don't feel sick. I hear people say, I trust my friends, but imagine your friend comes over and doesn't show symptoms, but has COVID and gives it to you. Then what if you take it home to a parent or grandparent? With COVID-19, it's especially important to protect people who are at higher risk for severe illness. Do your parents have breathing problems or high blood pressure? Do your grandparents live with you? You don't want to be the cause of their severe illness. Not cool, right? Yeah, so no parties. There are other ways you can connect with your friends, like video chats. How about a dance session to show off those moves? If it absolutely has to be in person, small groups, outside, with masks, and far apart, that's much safer. and you have to stay home if you're feeling sick, for everyone's sake. And about those masks, cool, right? Actually, they're one of the best defenses against COVID, which is spread by droplets from sneezing, coughing, singing, shouting, talking. You get the picture. And this is why masks must cover your nose and mouth and tuck under your chin. You don't want to let those droplets in. It's kind of like a snug raincoat for your face. The more we wear masks, the more we can ease up on other things. That brings us to social distancing. What does that mean? Does that mean I stop socializing? Not exactly. Social distance really means actual distance, and it's an essential step in preventing the spread of COVID-19. Social distancing means increasing the space and reducing physical interaction between people, which lowers the chances of spreading illness. Makes sense, right? We just gave it a weird name. So keep your distance at least 6 feet from people you don't live with. You can still socialize with people on your devices. I know it may be difficult to socially distance from friends and family outside your home. You may feel isolated and sad. Dr. Tribble, our behavioral health director, will address these feelings and provide you with some ideas on how to deal with mental and emotional health in the next segment of this video. So please stay tuned in. Okay, let's talk entertainment. Did you know that I can DJ hip hop? The good news is, I'm not going to make you listen to that here. But I'm talking about movie theaters, concerts, games, monster truck shows at the Coliseum. Yeah, I miss that stuff too. But it's not safe to gather in big crowds where you're right next to a lot of people you don't know, people outside your household. Why? COVID-19 is in our community, putting people at risk. Until we have a vaccine and more community immunity, you are at risk of getting COVID-19 and possibly bringing it home to your family. Now, you may start to see some of these things open up if we are doing a good job. If something is open, make sure you follow all the rules to make it as safe and healthy an experience as possible. I know this can be a bummer, but things like this have happened before. The 1918 flu, polio, H1N1 to name a few, and we got through. Hang in there, and we'll make it through together. Next up, indoors, outdoors, airborne transmission. Let's get into the good, the bad, and the ugly. I mentioned earlier that masks are important. Always snug over nose, mouth, and chin. Do you remember why? Yes. COVID is transmitted to others through the air, usually droplets from a sneeze, cough, singing, shouting. Okay, here we go. Indoors is good within your household or family. Indoors is not good inside a packed show, party, or any closed area where fresh air is limited and you're near a lot of people from outside your household. Indoor activities should be limited to small groups with face coverings, except when eating, and there should be plenty of room. Outdoors is good if you're around people you live with. Outdoors is not good if you're closer than 6 feet to people that are not part of your household for any period of time. And time is a factor too. The longer you're near others from outside your household, the more at risk you are for catching a dose of COVID from a sneeze, a cough, singing, or shouting. And that's ugly. And a big dose, a long exposure time, a large amount of droplets could make for a bad case of COVID-19. And that's definitely not good. And don't forget, indoors or out, wash or sanitize your hands frequently. So, what haven't we discussed yet? Oh, dating or hanging out with people you like. Yeah, it's complicated enough, right? And then there's COVID-19. The good news is that you can meet someone new and spend quality time together using technology and creativity. If you're meeting someone new, try a virtual first date using FaceTime, Zoom, or any of the other platforms that provide a visual connection. You can learn a lot about someone new by talking, like whether their personality meshes with yours or not. As you get to know each other and feel a bond, you could get a bite to eat by ordering takeout from the same restaurant and eating together by video chat. You could watch movies at the same time, even in separate locations, talking on the phone, or play online games together. When you're ready to meet, make sure you have the COVID talk including masks and distancing. Be clear about your concerns and be sure you're both comfortable. Meet outdoors, wear a face mask, and stay 6 feet apart. Be safe and show your date you respect their desire to be safe. Be creative about meeting in person, like taking a walk, riding bikes, or going to an outdoor restaurant. If it's cold, bundle up for walks or visit restaurants with outdoor areas with heaters. Take it slow and you'll find your way. And don't forget about the people you live with. If you take steps to meet in person, respect the risk you take for yourself, your date, and the people at home who may be more vulnerable to COVID. Keep in mind, while you may feel like COVID isn't that bad, others, especially older adults and seniors like grandparents, have a much higher risk of death if they get COVID-19. With these recommendations, you may be thinking, what about going back to school? You and your parents or caregivers are facing new and difficult choices, and you may be wondering whether you should stay virtual instead of going back to school. The Centers for Disease Control offers guidance for deciding how to go back to school. Go to www.cdc.gov and enter the word schools in the search bar. Some schools are offering parents a choice between in-person and virtual instruction. The CDC's decision-making tool helps you think through the choices. And since COVID-19 remains a public health emergency, class size, setting, and daily schedules will likely look different than past years. Your health status must be considered as well, especially if you have certain underlying conditions like heart or breathing problems, or a weakened immune system, or if you smoke or are overweight. If you live with people who are at risk due to health conditions, you'll need to weigh the benefits and risks of the educational options available to you. There are other important factors to consider, like the benefits of learning in person, but also the social interactions from school. Many of us, adults included, are experiencing social isolation and increased anxiety while not physically attending school because of COVID-19. You should also know that we are working with our schools to ensure that they have plans in place for preventing COVID. Schools are working on strategies like promoting behaviors that reduce the spread of COVID. You know them, we've talked about them, all together now. Stay at least 6 feet apart, masks on, wash hands, and stay home if ill. We know schools are an important part of our community, providing safe, supportive learning environments for students. Schools also provide critical services that help meet the needs of children and families, providing services for social and emotional skills, fulfilling food needs, and even exercise needs. Research currently indicates that COVID-19 poses low risk to school-aged children where there's low community transmission. Our rates in Alameda County are better, but we're not out of the woods. It's best to consider all the things we've talked about and read through the information available on CDC's websites when making your school decisions. I know what you're thinking. All right already, why don't we just get a vaccine around here? I like your style. There are people around the world racing to get a vaccine for all of us. In fact, as of mid-October, more than 150 coronavirus vaccines were in development, and the World Health Organization is coordinating global efforts to develop a vaccine in the hopes of delivering 2 billion doses by the end of 2021. I know, feels like a lifetime, right? You should know it can normally take 10 to 15 years to bring a vaccine to people. The fastest ever, the vaccine for mumps, took 4 years. Once you have a possible vaccine, it has to go through a 3-stage clinical trial process in which it is shown to be both safe and effective before getting official approval. And then it takes time to get enough produced and then delivered to communities around the world. But don't despair. We still have solid tools to help us avoid COVID-19. And you know the steps. Come on, say them with me. Stay at least 6 feet apart, masks on, wash hands, stay home if ill. Those prevention steps we just counted. Guess who they're most important for besides you? That's right, people we care about, like our parents, our grandparents, aunties, uncles, and older friends, as well as people with certain chronic medical issues. We protect each other by using those 4 simple steps. They're easy to do, they're super important for our older relatives and friends, and they're proven to reduce and prevent COVID-19. Just like flu, the measles, or a cold. Who wants to catch any of those? And think how you'd feel if you gave COVID-19 to one of these special people. And that reminds me, Most of us have not been able to be with our older relatives during traditional celebrations and family events. We've had to cancel gatherings and parties for important occasions, and it's been hard. As difficult as it is, it's important to remember that catching COVID would be even harder on them. But it doesn't have to keep you from getting together virtually. Schedule special time, like a meal where you can sit down together virtually to eat and visit with each other. Birthdays and anniversaries can be celebrated virtually. Have everyone in the family share one thing that they most appreciate about their loved one on their birthday. Ask your loved ones to share stories about how they met or one special thing about the other during an anniversary celebration. At the end of the day, just know that it's also okay to not be okay. It's rough when things you look forward to are canceled and you can't get together like the good old days. It's important to talk to trusted friends and family about what you're feeling. And if they're feeling overwhelmed too, it could be a time to reach out to a mental health professional, like my friend and colleague, Dr. Karyn Tribble, who will talk about mental and emotional health in the next segment. And now, it's time for me to go. Thanks for listening. Please share what you've learned with others. Practice the 4 steps to prevent COVID-19, and be well.
Hello, my name is Dr. Karyn Tribble, and I'm the Director of Alameda County's Behavioral Health Care Services Department. I'd like to take a moment to speak to you about the mental health needs at the time of the novel coronavirus or COVID-19, specifically getting back to routines, and a focus on the behavioral health of our children and youth and their families. You see, there's so much happening every day, so it's important that you think of how to keep your own health and wellness in mind, even if you think all is well. We are all facing the ever-changing landscape that has become the new normal through the novel coronavirus pandemic and the reawakening of social justice reform across our nation. Things are intense right now, and sometimes we feel and we think so many different things, sometimes over the course of a single day. Many people, regardless of their age, are feeling the pressures of virtual school or work, changing how they interact with others and wondering whether they are safe. Well, just know you're not alone. As schools begin to reopen and sports and other social activities become more compelling parts of our lives, it's important to remember that you have not only been spectators to one of the most historical years in our modern history, you have been shaped and are being shaped every day by our environment. I had the opportunity to speak with many individuals and organizations about the importance of holistically approaching wellness. And this whole person approach is that much more critical to the lives of children, youth, and the family groups to which they belong. That just means considering as much as possible about a person when you think of how to be as healthy as possible. First, it's important to remember that our world has been rocked to its very core. We have and are experiencing a worldwide pandemic. Everything that we consider to be normal has changed. So we know in terms of COVID-19 and now the flu season as it is upon us, there's much more to think about in terms of our health. Think of what you, your peers, family members, or others around you, or even TV programming and social media are expressing just about social justice. A lot of what used to be normal is changing, and how we think of the future might also be changing. And here we are now, trying to get back to our, quote, new normal routines. Looking at how you get back to your routine means you think about yourself from a big picture, a big point of view, or holistically. Specifically, think how you are doing and what you will need from 4 different perspectives. First, think of your physical health, your emotional health, your social health, and how you're doing simply as a person in this world. Believe it or not, just looking at yourself from a whole perspective can be a strategy that helps you get a sense of what is working for you now, and it can also help you get back to the best routine or best place you can. This is called the holistic perspective. Let me give you some examples. So when you think about how you're doing from this perspective, you can give yourself choices and can also help normalize what you might be feeling. We're all going through this complicated time. If there are things that work best for you, you can also plan for how you might approach the next day or the next week or even the next month. This can be especially helpful as you're trying to find balance again when starting to do things that you used to do before the world changed so dramatically. Maybe thinking about how am I doing physically today? do I need to eat? Have I exercised today? Did I take my vitamins? Can all help you plan for your physical health and can keep your body healthy. If one day you feel a bit tired from starting your new schedule or back to normal routine, you might want to plan for taking more time to get some rest the next day. That is considering your physical health and or your biology. Also, consider how you're feeling and thinking about things around you, your emotions. Are you happy or a little down, perhaps a little anxious because of your job? All of that is to be expected. But what's important is that you take your own psychological temperature. You're checking in with yourself. You don't have to do this every day, of course, but it might be worth considering using a journal or maybe a note on your bedroom mirror or to remind you to pause and take your emotional temperature. Again, your emotional health at this time is very important. Because maybe tomorrow or next week, you might just want to readjust. Maybe do something differently, or perhaps reach out to a friend, your parents, or a family member, or someone you trust. Maybe things went well, so you might want to keep doing it. That way you help strengthen your emotional habits that will work well for you. Like your physical health, your emotional health should be on your radar too. There are things that can be stressful as you return to your routine, so know that every emotion is human, and so it's okay if you need a little help at times. If things are going well and you see that you can reach out and connect to others, perhaps too you can be a trusted friend for someone else. Considering your own emotional health, your thoughts and feelings is taking you that much closer to that holistic approach. So, you've considered your physical health and your emotional health. What's important to consider next? Well, I'm glad you asked. Besides considering these two parts of your experience, it's important to also consider how you are doing or your plan, both socially and as a young person in general, while simply navigating through these complex times. It might sound complicated, but it's actually something that most young people and families do every day. Consider your contacts with your friends, your family, your peers, and any groups that you might belong to, even if they're just social media. Are you spending time with them? Can you maintain social distancing? And are you able to, quote, play? Sometimes just to burn off stress or simply relax when you can. Are there study groups that can help you feel less isolated when getting back on track with school? These are examples of how to take stock of how things are going for you socially and how to possibly recalibrate if your new routine seems to be a little more challenging than you expected. Your social health and wellness is just as important as your physical health and as your emotional health. Finally, how are you doing in terms of how you're preparing to get back to your normal routines? So many things have occurred these past several months. So many things have changed your beliefs, how you see yourself with your friends or in the community. What is really important to you? Well, as you prepare to restart things again or do activities that you may not have done before, I encourage you to take time to really see yourself again. You are worthy and you are worthwhile and have a set of beliefs and practices. Sometimes this is shaped by your family and sometimes this is your experience. They can help to remind you of what gives your life purpose and meaning. It's important to remember this is part of yourself, that inner voice, that personal outlook or that spiritual journey. If it has helped you guide you before, it may be a resource to you as you navigate these times. Your practices and the support that helped you might also help you refocus on the next phase of your life's routine. If you would like to be of support to others around you, I encourage you to follow 3 basic steps. First, ask and listen, and don't be afraid to ask direct questions. Your support can actually be a lifesaver, especially these days. Number 2, seek professional help and resources. It's always important to seek out and get assistance if you have any concern, even if you don't know what to do or what steps to take. Others around you might have what is needed to help. And finally, number 3, remember returning to your routine is a journey. Readjusting takes time and commitment. This has been a year to remember, to say the least. All that we discussed, well, it represents a holistic or a whole person approach to getting back to your routine. It's a way to look at how you approach these next several days, weeks, and months, and can help you to make sure to keep tabs on things and how things are going for you. As I've mentioned earlier, with so much happening around us, many people will find it hard to focus on what's really important, let alone getting back to their old routines. Be patient with yourself. Seek help and support when you need it. And be open to simply planning your routine one day at a time. Just one holistic day at a time, just in the beginning. After a while, this new routine will become, well, routine. So on behalf of Alameda County Behavioral Health Care Services, I wish each and every one of you all the best. Be safe, be healthy, and be well. Thank you.
Okay, I hope you all enjoyed the first episode of the Mental Health Series. We learned a lot about COVID-19 and ways to stay safe and strategies for addressing mental health concerns. In the next episode, we'll be discussing stigma around mental health, as well as the effects of social media on our daily lives. Let's close out this episode with a song by a brilliant Bay Area artist, Samantha Margret. See you next time. Thank you.
Anxiety lies to me, and then when I try to see the truth, I just can't see. I'm not who I want to be. I wake up each day, it says that dream is out of reach, but anxiety lies to me, so I'm gonna try. I'm just the girl on stage. I have to admit it feels like she has more to say, but anxiety lies to me, so I'm gonna try. And I'm I'm gonna try. And I'm gonna fail. And I'll stitch myself back up when I come untied. Anxiety lies to me.